So, hello. Today we will present a case of a patient with 62 years old man with cirrhosis and portal hypertension and gastric varices. So here we will present a new technique that is US guide coil plus cyanoacrilate injection for the treatment of these gastric varices. So I am here at the level of the esophagus in the cardia region, and we can see here the gastric varices here, okay? So one tip for this technique, if you have any kind of doubts regarding if you are very well positioned, because sometimes you can have a splenic hypertension area and you cannot see very well the gastric varices, is to put water, okay? So I will put water, pásame agua por favor, to see exactly the gastric varices in the fundic area. So here, I will explain to you here, this is the gastric varices here, and this is the stomach wall here, and this is the gastric fundic area here, okay? So when you put water, you see here, okay? You can separate the walls and you can see very well if you are in the correct area. So as in our unit, we use also angiography injection to determine exactly if we are in good position to avoid any kind of complication. The other important thing is to see where is the feeding vessel of this varice. Okay, I think this is the feeding vessel here. So we will see with Doppler. And this is the area where we need to put our needle. So I will try to explain to you each step to perform this procedure. Okay, so I will use a 19 gauge needle from Boston Scientific. The standard needle is okay to perform this procedure. So here we need to recognize the anatomical aspect. Here you have the esophageal wall, and here you have the stomach wall. So we will pass between the esophageal wall and the stomach wall to arrive to this area. Dame la aguja. We will block our US. We need to be sure that we are inside the vessel, okay? So here I am sure that I am inside the vessel, and I will okay, puedes retirar por favor. So I will perform an aspiration, and we can see also by fluoroscopy where is the tip of our Okay, okay, okay. Dame agua, por favor. Un momento. Okay, so you can see here we're exactly in the fundic area with our needle. So now um, I have the view of the X-ray and also esto es contraste o agua? X-ray and the US. So now we can use also contrast to see by X-ray if we are in a good area. So you can see here, this is the fiddle vessel because the traject of the contrast is going down. ¿Puedes subir la camilla, por favor? Sube la camilla. Un momento. Súbela, súbela, súbela. So this is the fiddle vessel of this varieties, okay? Dame agua, por favor. So any pass of contrast or any coil that I put inside, I always clean with saline solution the needle. Toma esa foto, por favor. Ok, dame coils grandes quiero. Deja ver qué hay. No, debe haber más grandes. Okay, so I will explain to you what kind of coil I will use now. So we will use the Nestor embolization coil because this is a very good coil that could pass inside the 19 gauge needle here. So this coil have three measures. The first one is 35, correspond to the guide wire that you need to use to push the coil. 20 millimeters remain exactly the longer of the coil, and 16 millimeters correspond to the diameter of the coil once it is deployed. Okay, so I will try with this coil because this is a big variety. As you can see here, we are in the fitting area vessel. Okay. Uh, sí, puede ser, da igual. La eco está bien. No sé si podemos ver un ratito el rayos X en grande. So I will show you the X-ray in a big in the big screen. ¿Estamos con el rayos X en grande o no? So you can see the triad of the contrast. So it's going down to the portal vessel. So that is this is the feeding vessel. So it's okay. So we are in a good position to do the treatment. Okay. Okay, volvamos a la pantalla con ecografía, por favor. Okay, momento. So I will show you by X-ray. So now by the US, the coil is going inside the varese. Okay, let's go. Go. Dale. No. Okay, it's okay, it's okay, it's okay. So there is the coil, and we can now retire the guide wire, and you can see by X-ray. Now I need to see, to show you also by US. ¿Puedes poner la imagen de ecografía, por favor? ¿Tenemos la ecografía? So here you have the coil, the first coil, but this is only one coil. We need more coil, at least two more coils to complete or occlude the vessel, okay? So we will put another coil, please. Otro coil, parecido, está bien. Sí, sí. ¿Cuál que abriste? No importa. Dame el 14, está bien. So I will put another one. You can use, in this case, another of the same diameter and the same length, but we will put another one of 14 millimeter of after deployment. Vale, sí, vale, sí, sigue, sigue, sigue. Ok, ahí está bien, retira. So we have two coils and I will put another one. In this case, because the varese is very big varese, okay? So we need to put a very good, um, we don't need to have any space between the coils before to put this cyanoacrylate injection. Dame uno más pequeño, por favor. Sí, puede ser 10. Ah. 12, 12. So we will put the 12 millimeters now. So we can see, estamos viendo la parte ecográfica. O un 14 está bien. So now we can see here this diminish of the ahí está llegando. So now it's coming. Go. Sigue, sigue, sigue. Ok, listo, retiramos. Okay, so now we have three coils inside this varese. It's a very big vessel, and now we can put the. You can see here the. Podemos ver la parte ecográfica, por favor. Okay, so we can see the diminish of the fluid inside of the vessel. Okay, so now, so we have a very good initial response. This is very good. Okay, so we don't have a very good nutrition of the vessels here now after the coil. So we will put now the injection of cyanoacrylate. So we don't need to retire or needle, only we will flush with saline solution. Dame solución salina, por favor, primero. Dame unas 6 ampollas, por favor. So first I will flush my needle to avoid any clothes inside or any rest of the my guide wire. It's very good to do that, okay? Me avisas. Yeah. So now we will change our saline solution and I will put the cyanoacrylate injection. And I will flush again. So here. So you have less flux inside the vessel. This will be diminished in few weeks and here is okay. So I can retire my needle now. And here you can see no more vessel here, okay? So this varix will disappear soon, okay? Podemos retirar. You see here, less flux inside the vessel. That's good. And here, the fetal vessel totally occluded, okay? I will show you now the endoscopic aspect with the gastroscope, okay? Voy a necesitar la imagen endoscópica ahora. Toma esa foto, por favor. Gracias. Claro, hacia claro, hacia el vaso.